My name is Alex Magnussen. I'm a consultant upper limb surgeon, and here are some of the most commonly asked questions about sports injuries of the upper limb. So, what are the most common sports injuries we see? Well, almost overwhelmingly, they are subacromial shoulder pain and tennis elbow. So how are these injuries caused? Whilst these things are called injuries, they aren't necessarily caused by an isolated injury. More often they are caused by repetitive use, repetitive trauma. A particularly strenuous game of tennis, for example, or a whole season of tennis, or repeated poor technique in the gym can lead to these injuries, both in the shoulder and in the elbow. What happens if I don't get treatment for these conditions? It's really important not to play through the pain, because whilst when these things begin, they can be treated very effectively with, for example, simple analgesia. If we carry on, we can lead to structural damage, either in our shoulder or in our elbow, which can be more difficult to treat. What should I be doing to try and avoid these injuries in the first place? For a start, the lifestyle that we all adopt in 2025 is pretty bad for your shoulder. We all work from home at desks and chairs that aren't necessarily designed for prolonged computer use, and particularly our phone, we're all a bit like this. We all have our heads forward, we have our shoulders rounded, and what that does is it closes down that space and predisposes you to injury. If you spend a long time working at your laptop and then go and have a session in the gym, you're that much more likely to sustain an injury. How do we diagnose these conditions? Here at Welbeck, we have access to state-of-the-art imaging technology. Following a comprehensive clinical examination with myself or my colleagues, we would then send you off for a scan, whichever scan is relevant, be it an ultrasound scan or even an MRI scan, which should help us pinpoint exactly what the diagnosis is. Do I need surgery? Not necessarily. A large amount of these conditions, if caught early, can be treated non-operatively, and this would include coordinated physiotherapy such as gym routines or alteration of your techniques when you're on the court or on the gym floor, for example, through to targeted medical injections. Ultimately, some of these conditions might require surgical fixation. However, the outcomes for this are excellent. The vast majority of these procedures are day case, and they involve a surprisingly short visit to our premises. Patients come in the morning, they have a relatively quick procedure, and they are home in the afternoon. If you play sport, professionally or just for fun, chances are you will deal with an injury at some point. However, early diagnosis and coordinated treatment can allow you to get back on the tennis court, the football pitch, quickly. By coordinating your care and coordinating your rehabilitation from an early point of view, we can rehab easily and speedily through any niggles you may have and get you back to full function pretty quickly. So if you have been struggling with one of these injuries, please don't put it off. Contact one of our expert team here at Welbeck and we'll get you a quick appointment here with us where we'll be able to find out exactly what's troubling you and work out the quickest way to get you better.